Hello, everyone. Thank you for joining us today. The questions featured today are questions that current students have about careers in the field. We are excited to introduce you to the range of opportunities and to provide an overview of the supports and tools that we offer to help you land your dream job as an SLP. So the first question that we have today for Professor Dargin: what type of career supports are students provided to assist with securing a job after graduating?
Well, I think that everyone on faculty is happy to write letters of support for those going into the field. So after graduation, students need to complete a clinical fellowship year, which is basically a 36-week paid program in which they're working towards their clinical certification. So they have a job just like you would if you had your certification already, but you're working under someone else's license. So you're paid probably just a little less than a typical certified practitioner. However, it is a job with a real substantial income. And so we help students match their interests to the field that they're interested in. If that's medical speech path, then specific areas in medical speech path could be swallowing or voice, etc.
Great. And what do SLPs do exactly? You started to share some examples, but can you go more, share more about what SLPs do and what settings do medical SLPs work in after they graduate?
Yes, so medical SLPs typically work in a hospital, but they don't always have to be in a hospital. It could be a nursing home environment, it could be private practice. And medical speech path, typically, I mean, our degree program for career it's very broad and it's very deep as well. So we have many avenues of different diagnoses that we treat. So we can work with someone who has autism, someone who has had stroke, neurological damage, for those who have swallowing issues. So you might be in a rehabilitation program that works on swallowing, or you could work with voice and voice disorders. So if somebody has a laryngectomy or removal of the larynx, you could work with fixing their tube. You could work with helping them to phonate in their new voice that they have. And so you might be in an ear, nose, and throat clinic where you are the SLP and you work specifically with that type of thing. Or also in an ENT office, you may work just with voice. So you might have patients with muscle tension dysphonia that tighten up, that you're working with them in a therapy sense to make their muscles more loose, so that they can phonate in a more relaxed manner. So those are just a tip of the iceberg of settings in which SLPs may find themselves, but the area is wide in which they could find work.
Great, thank you. What is the most common career trajectory for an SLP post-graduation?
So as I mentioned before, an SLP has a 36-week or up to a year clinical fellowship year in which they are working under an already licensed clinician. So they would most likely be in a setting like that. So to get a CFY, you can work, whether you want to work medical or language, you can work the gamut as long as you have the knowledge base to help yourself. So some people will move and go to the exact right position that they want. If they want to do voice, they may be in New York, but they'll move to California for the perfect career. Whereas If you really want to work in voice and you can't move, some people may decide to work with language for a few years until a voice position opens up. So because of our depth and breadth, we have vast flexibility and able to find jobs. Some students decide to go on to a PhD, and so the master's degree is a clinic degree in which you have to work 9 months to get your clinical fellowship. That can also be done on a part-time basis as you begin a PhD program.
And just one follow-up question. Can you talk a little bit more about the fellowship and how students secure that post-grad fellowship?
A clinical fellowship year is, like I had said before, much like a job. So you would secure this just as any other job. So I view it basically the same as applying for a job, and you're just under someone else's license for 9 months who is guiding you through that process. They have to observe you on a very minimum basis during that time. So it is much like you go out and you look for job postings. I think LinkedIn and Indeed is a popular place in New York City. There are third people companies in which they will employ SLPs as CFY or CCCs. CCC is what you get after your name after you finish your CFY or clinical fellowship year. And those jobs, you're a contractor basically, in which you could do home health care, and you could go from family to family, transporting yourself to those places. You are paid quite well. And so those are the ways you go. So you send in a resume, you send a cover letter, and the rest goes from there. There's definitely a shortage of SLPs, so you will not have a problem finding a job.
Great, thank you. And that leads to our next question. What are the best geographical locations for career opportunities for our SLP graduates?
I think there is no best geographical location. So there is, I think we're in the top, I don't know, at one point we were at the top 10, at one point top 4. I don't know where we stand right now in SLP as a career, but we're definitely in need because we have a shortage of SLPs and more demand because of the aging population and because of the more expansive early intervention programs. So you can find a job anywhere. It's that's the beauty of having a clinical master's program, is you could move to, in the middle of a cornfield in Kansas and be well secured in a job, a good job, or you could move to LA or New York or Canada and as well be fairly secure in a job.
Great, thank you. And are there?
And I think that also for those of you who are worried about tuition costs, the nice thing about our career versus a lot of other careers, including attorneys and business people, that the return on your investment is great, because you may be a little worried about going to school, especially with the media at this point, where you put a lot of money into school and then what you have afterwards. The nice thing about SLP is you definitely will have a job. I won't mention a number because that changes, but I think that you are well paid in a starting out position compared to other careers. And in fact, I think you might be on par with attorney starting fees in the typical job market. And so it's a good return on your investment.
Great. So can you talk a little bit more about advancement opportunities in the field?
Yeah, so the advancement is, so you start as a CFY and you're paid almost par to a CCC at a starting salary. And especially in the medical setting, your increases in your salary and benefits just grow with the years that you're there. So I can't give specific numbers or specific places that, number one, I don't know them. Number two, that would be inappropriate. But I think that you definitely can expand in this career and move up into supervisor positions to where you're the head SLP and maybe you're the head person educating future CFYs. And there, I mean, depending on what you want to do, you could go into managing a health organization. You could do many different things. You could go into teaching. You could do adjunct teaching while you're a practitioner. Because we have such a breadth and depth of the field in which, or the areas in which we treat in our field, there's no way that a full-time faculty can cover every domain. So if you're a specialist in autism, or you're a specialist in AAC, or you're a specialist in voice, or you're a specialist in swallowing, whatever it may be, you could easily start as an adjunct if you wanted to start teaching. And advancement, of course, PhD route and teaching and research. So the ability to advance is definitely very high, again, because we are growing an in-demand field.